Nutrition Basics Part 1. Diabetes. Diabetes is a long-lasting health problem that affects the way your body makes energy from the food you eat. When you eat, most plant foods are broken down into sugar, which is called glucose. This glucose goes into your bloodstream. You need glucose to give your body's cells energy. An organ in your body called the pancreas makes a substance called insulin that helps glucose move from your blood into your body's cells to use for energy. When you have diabetes, your body is not able to get enough insulin. Sometimes your body can make enough insulin, but it is not able to use it properly. When your body does not have enough insulin, you have too much sugar in your blood. This causes serious health issues such as kidney disease, vision loss, and heart disease. Diabetes does not have a cure. However, being physically active, losing weight, and eating healthy can be helpful. Once you get diabetes, you need to manage it with medication, healthy eating, and exercise. Here are some symptoms of diabetes. You easily become thirsty and drink too much water. You use the restroom frequently. You easily become hungry. You have numb or tingling hands and feet. When you get a cut or wound, it takes a longer time to heal. You can also easily become tired and experience unexplained weight loss or blurred vision. There are two main types of diabetes: type 1 diabetes and type 2 diabetes. Type 1 diabetes is a chronic condition in which your pancreas makes little or no insulin. It normally affects children. Your immune system attacks or destroys your pancreas that makes insulin to help your body use blood sugar as energy. Type 2 diabetes is a chronic condition where your pancreas makes less insulin than your body needs and your body is not able to use insulin the way it should. Sugar becomes too much in your blood. Type 2 diabetes normally occurs when you are overweight or obese and when you are not physically active. It also runs in families. These days, some children are getting prediabetes and diabetes, so eating healthy and being active are very important for them too. Although diabetes has no cure, you can manage it well with healthy eating and physical activity and healthy body weight. Here are some basic guidelines for managing diabetes. Eat regular meals throughout the day. Make fruits and vegetables part of your meal. Aim to make half of your plate fruits and vegetables at both lunch and dinner. Reduce the serving size of your meals and snacks. Too much eating can make you gain weight. Weight gain will make it difficult for you to manage your diabetes. Include high fiber carbohydrates such as whole grain bread, oatmeal, brown rice, corn, quinoa, sweet potatoes, and potatoes at every meal. Avoid eating saturated fat, processed meat, fried foods, and foods that have too much sugar, such as cakes and pastries. Eat low fat dairy products, lean meat, legumes, nuts, and fish eggs. Aim to eat oily fish such as sardine, salmon, and mackerel, tuna, at least 2 to 3 times a week. Limit your intake of salt and alcohol and avoid taking soda, flavored water, and energy drinks. Physical activity is just as important as nutrition in managing diabetes. Try to do physical activity at least 30 minutes a day, 5 days per week. Tips for increasing fruits and vegetable intake. Eat fruits such as melon or grapefruit at breakfast. Add bananas, raisins, or berries to your breakfast cereal. Add chopped up vegetables such as spinach, bell pepper, and onions to your eggs or potatoes. Have a fruit or vegetable salad with both your lunch and dinner. Put vegetables such as lettuce, cucumber, tomato, avocado on your sandwich. Keep raw veggie sticks handy, such as green or red bell peppers, green beans, celery, or carrots, and eat as a snack. Carry dried fruit such as raisins, dates, or dried apricots, and fresh fruits such as banana, grapes, oranges, and apples in your purse and snack on them. Add chopped vegetables like onions, garlic, and celery when cooking soup, stew, beans, rice, and any sauce.